At the World Health Summit, the threat of superbugs is a key topic for thousands of health experts. There is growing concern over bacteria that's become resistant to antibiotics. CCTV's Guoxiu shows us how China is addressing the issue.
When treated with antibiotics, bacteria can develop resistance, sometimes to multiple drugs, thus becoming dreaded superbugs. One of the most famous superbugs is MRSA. It can cause an infection whose resistance makes it difficult to treat and can be life-threatening. But data shows it's dropping in China.
The rates of staph bacteria that are antibiotic resistant dropped from 70% to 30 to 40% in many hospitals in China, thanks to the strict control in antibiotics usage in recent years.
In China, antibiotics are not reachable in drugstores anymore without a prescription, at least in big cities. Doctors are required to use as little antibiotics as possible. Hospital evaluations even take usage into account. At Peking University First Hospital, the amount prescribed for outpatients has dropped by half since 2006.
Since 2006, patients in this hospital kept increasing, but antibiotics usage kept decreasing, while infection status didn't change much. The controlling effect is more obvious since the government issued its strictest regulation since 2012.
However, Professor Zheng says two other kinds of superbugs are still a serious threat in China, and it's not just a medical issue.
It's widely known that the animals we eat are fed antibiotics. When the food chain has antibiotics, bacteria in the environment could develop resistance and infect humans.
With this threat in mind, China is working to develop quicker detection methods and better drugs and even vaccines to fight superbugs. But experts believe more needs to be done to educate the public on the scientific use of antibiotics, especially in less developed regions. Guoxiu, CCTV, Beijing.